Hi, everyone, and good evening. I am Councilmember Mike Bonin. I want to thank you for joining me tonight for our very special town hall held virtually via Zoom to discuss mental health issues in our communities. Just a bit of a note as we get started here. If you need Spanish translation, we have that available tonight, thanks to Veronica Lemley, who's joining us tonight. To hear the Spanish translation, please use the interpretation button you will see at the bottom of your screen. That button is right at the bottom of the screen. It should give you some options and you can check Spanish from there. So as folks are gathering on, we'll just pause for just a second before we get underway. It'll be just one more minute. Again, if you're just joining us and you need Spanish translation, you can go to the bottom of your screen. There is an interpreter button there, and you can use the options and select Spanish. And we have tonight's town hall and everything that I say and everything our guests say available in Spanish. And I think we're good to go. So we're gonna get started. Again, for those of you who just joined, thank you for joining me. I'm Councilmember Mike Bonin. I'm here along with a distinguished panel of guests tonight for a virtual Zoom town hall to discuss mental health issues in our community. Over the past year since this pandemic began, my staff and I have been putting together a series of town halls. We have had discussions about renters issues. We've had discussions about issues that are important to small businesses and to seniors. We've had discussions about reimagining public safety in Los Angeles, and we have had a couple different discussions about the public health crisis that we are facing as a result of COVID-19. Tonight, we're going to give some very special attention and well-deserved focus to the issues of mental health in our communities. Even before COVID-19 hit us and this pandemic struck, millions of Americans were facing mental health issues. Across the country, many people like you and me work, perform, create, compete, laugh, love, and inspire every day. And many of them are encountering and facing mental health issues, and you may not even know about it. People with serious mental illness have an increased risk of chronic disease like diabetes or cancer. Rates of cardiometabolic disease are twice as high in adults with serious mental illness. 18% of US adults with mental illness also have a substance abuse disorder. At least 8.5 million Americans provide care to an adult with emotional or mental illness. This isn't just a question of the people who have the mental illness, it's a question of all those around him or her and the support system that is needed to help them. Caregivers spend an average of 32 hours per week providing unpaid care. Disproportionate numbers of unhoused people, of our prison population, and of our juvenile justice system suffer from and face mental health issues. Depression, which I'll be very clear about and candid about, is a situation that I have suffered with for over 10 years now, is a leading cause of disability worldwide. Depression and anxiety disorders, which many people suffer with silently, and you don't even know that your coworkers or family members are experiencing those, cost the global economy $1 trillion each year in lost productivity. And in addition to the economic and public health crises, there has been a great need for mental health resources across our city and across our neighborhoods right here in Los Angeles. And we want to discuss those issues today and share resources that can help you and your neighbors and your family, because things have gotten a lot tougher during this pandemic. Many families, we'll hear questions from tonight, are concerned about the impacts on kids of doing remote learning, of parents working from home while helping kids get through this crisis, and of seniors who are facing isolation. We also have economic issues that are intertwined with mental health issues, from essential workers facing hazards on the job to unemployed people dealing with lost income. And then, of course, many of the typical stress relievers, whether it's working out at the gym or seeing loved ones, have not been available for nearly a year now. Accordingly, there has been a rise in alcohol and substance abuse. We are lucky, though, because there are great organizations right here in Los Angeles and right here on the West Side that are helping Angelenos deal with these issues and more, regardless of their income and regardless of their ability to visit in-person facilities. We're now going to hear from a couple of these leaders before we go to questions. They'll provide overviews of their work and of the resources they offer and that they are offering to individuals and families on the West Side and across the region. I'd first like to introduce the first of three panelists tonight, Dr. Jonathan Sharon, who currently serves as a director of the LA County Department of Mental Health, and that is the largest county-operated mental health department in the United States. It serves over 250,000 people per year. And Dr. Sharon has done a phenomenal job on groundbreaking research efforts in the field of neuroscience. He's been an educator at UCLA and USC and has been a mental health leader and a champion for veterans, for low-income people, and for underserved groups. I want to thank Dr. Sharon for joining us tonight and give him a few minutes to talk.
Well, thanks so much, Councilman, for having me join you tonight to talk about what is a massive problem. And, you know, at this juncture, there are so many different things that are impacting the mental health of individual people in our collective, in addition to challenges and inadequate access that you know, predates COVID, you know, and you bring in COVID, and then you bring in a lot of the economic hardships, which really target vulnerable populations, issues around social unrest, information overload, the number of things that are impacting the way that people kind of navigate their daily routine is it's unprecedented. I do appreciate your focus tonight on the homeless population, and you know, I'm looking forward to having a lot of time to talk about it. But what I would like to say is that there are people, and I'm going to say it's the minority of individuals who are homeless, many of whom are chronically homeless, who are homeless in large part because of their mental health condition and or their comorbid addiction. But the vast majority of people who are homeless, and that number is growing dramatically, and you can see it with your eyes, are homeless because of socioeconomic factors. Now, becoming homeless and spending time in the streets is a devastating and traumatic experience. So many of the people who have become homeless, not primarily due to their mental illness and the severity of their addiction, become homeless and develop serious mental health challenges. The trauma of being on the street, of being victimized on the street, the issues with broken families, with lost jobs, with incarceration, which all of these things tend to commingle as things start to fall apart for individuals, is really kind of devastating. And we in LA County are the epicenter of need in this country. And I do want to honor you and your courage recently stepping up to basically say something that I think I say with you, and I've said it for a long time going back to my career in the VA, which is we actually have a national disaster, and we need to have a crisis response. And maybe it can be focused in those areas that are so bad, you know, that are suffering so much, such as Los Angeles County. But can we please step up and recognize that we cannot have folks languishing in squalorous conditions on our sidewalks, under our freeways and bridges any longer, and that it's not just health and dignity, it's actually a threat to our entire population. And I think there are so many people that are charged about fixing this problem across the board that we have no choice but to act. We have that momentum from the grassroots to the grass tops. Can we please move forward? Thank you for giving me a chance to introduce myself.
Amen. Thanks, Dr. Sharon. And up next, I'd like to introduce a friend of mine, Eden Garcia-Balis, who is a licensed family and marriage therapist who leads the Airport Marina Counseling Service in Westchester, which I'm very proud to have here in Council District 11. She has years of experience leading mental health organizations and delivering mental health services to people regardless of their income. She's been with Airport Marina Counseling Service for about 7 or 8 years now, and they do a phenomenal job in the community and have been around for a long time, back when people were not talking about mental health and it was still something that got whispered about instead of talked about. Eden, thanks for being with us tonight.
Thank you so, Mike. Thank you so much, Mike. It's a pleasure to be here today. I'm excited to be here and share the work that we do at Airport Marina Counseling Service, or AMCS as we like to call it. As Mike said, I've been with the clinic for 7 years, and my passion is to ensure that people get quality mental health services regardless of their socioeconomic level. So I do have a little PowerPoint presentation that I'd like to share as I speak. And am I sharing?
Yeah,
yes?
Go ahead and do the share button, Eden.
Okay, got it. So I'm not sharing. Okay, so let me do the share button. Here we go. And oh, you can see all my stuff. And there it is. Yes? All right, success. All right, so AMCS, counseling and COVID. What do we do? The mission of Airport Marina Counseling Service is twofold. It's to provide affordable community-based mental health services and to train mental health therapists. And this really drives all of our services at the clinic. We provide individual and family counseling. We have group therapy sessions. We have an at-risk kids program where we provide free services to local schools and the Boys and Girls Club of Venice. We also have psychiatric services, and I'm proud to report that we also have a child psychiatrist on staff. You do have to be a client at the clinic to see our psychiatrist. We offer couples counseling. We have a Hannon immediate intervention program. And this is where you have a sudden issue that comes up, then we will quickly fast track you into the clinic. And this could be something like the loss of a loved one or a traumatic event. And our newest program, although it's about 3 years old now, is our LGBTQIA Affirmative Therapy Center, where we provide specialized services to the LGBT community. So pandemic hit, and what were we going to do? We quickly pivoted, and that's my favorite word, pivot, although I hear people are completely over it, and we moved to telehealth services. So currently we are shut down for in-person services, but we are providing phone and video conferencing. So we're still addressing a need. What we're finding though is that people are really enjoying the telehealth services. When I looked at our research and our statistics since the pandemic, we are seeing a 50% reduction in no-show rates and cancellations. So people are working from home. They quickly, jump onto their therapy session and are able to get back to work without the hustle and bustle of traffic. So we are really looking at keeping telehealth. Before the pandemic, telehealth was not a priority, and we're really seeing it as an opportunity to expand the way that we provide our services. So what do you need to do to get services at the clinic? So our intake process is very easy. We do have a receptionist answering the phones from 9 to 5 on Monday through Thursday. You call the clinic. She will schedule an initial consultation with the therapist, usually within a week. Then we do a phone consultation, yes, just to make sure that we are right for you. We want to make sure that we're able to provide the services that you need. And then your services begin. We don't have any government contracts or contracts with the Department of Mental Health. All of the services are on a sliding fee scale depending on your ability to pay. We call it client driven. You start when you want to start and you end when you want to end. I'm glad that I remembered this. We are offering free initial consultations for the month of February, which means that your first appointment is free. We also have a variety of groups. We have a men's group, and you can see the list here. I don't have to go through it. But our groups are really brought on by the needs of the community. We've done a happy holidays with a question mark group. We've done a trauma support group during the terrible shootings that have happened. So it really depends on what's going on. When the pandemic hit, you know, it really made everybody's life change, and everybody's concerns are valid. People are still scared almost a year later. They're scared about getting sick. They're scared about giving the virus to somebody else. People have lost their jobs, and it's still scary. And what can you control? So the most, you know, with the pandemic, there's so much out of our control that we really need to focus on what we can control, which is our mind and body, a healthy diet, exercising, getting enough sleep, everything in moderation, alcohol, smoking, your immediate environment, trying to live pre-COVID, although I know that's difficult. You know, what did your room look like? How did you clean your home? All of that good stuff. What you can consume. So I know I have the news app on my phone, and that thing constantly goes off. And I found myself constantly looking at what was happening in the world. And it was giving me a lot of anxiety. And I had to come up with a plan for myself. How often am I going to look at this? Because I want to be informed. But how much do I really need to look at this? And also doing just some really fun things, some fun movies, videos, walks, things that can balance it out. How you prepare. Being prepared also helps relieve anxiety. So if you have enough food in your home, I know the shortages aren't an issue now, but they certainly were back in March, just making sure that you have enough food, enough medication, and protecting yourself. I don't have to go through this list because we do this every day, right? Washing our hands, being socially distant, just all of that. So anxiety. And I talk about anxiety because anxiety is depression, as Council Member Bonin pointed out, Mike, that this is just rampant right now, especially during the pandemic. And it really presents itself in a variety of ways. These are the same ways that it presents itself with kids, stomach issues, you know, both adults and children, uncontrollable ways of thinking, irritability. These are just all things that you really need to look out for. And how do you manage it? Well, ask somebody to be your support. Do you have a buddy? Do you have a group of friends? I know I have a group of texting friends, and we regularly chat to support one another, especially when it's hard, and especially for those of us that have children at home and working from home and trying to manage all of that. And exercise at home. Exercise is so important. I have two boys, a 10 and a 12-year-old, and I told them to go for a walk today, and you think that I asked them to like cut off a limb. It was such a challenge, but I know that as soon as they get out, it's going to be rewarding and they're going to enjoy themselves. Resources, there are like this, the crisis text line. There's just a bunch of other things that you can do. Mindfulness apps, setting a new routine, stretching, breathing, all very, very helpful. So again, I am thankful that I'm part of this panel. And here is our website, amcshelps.com, our info line if you want to email us, and our phone number, 310-670-1410. Thank you, Mike.
Thank you. And nice cameo there from Fritz Coleman, the MC at the annual Airport Marina Counseling Service event.
Right.
Thank you so much for that presentation, Eden. Next up, our next panelist is Dr. Jonathan Goldfinger. He is the CEO of the Didi Hirsch Mental Health Services here on the West Side. They offer free mental health, substance abuse, and suicide prevention services and have been doing so since the 1940s. Dr. Goldfinger previously served as the Chief Medical Officer and Vice President of Innovation at the Center for Youth Wellness. And there he oversaw national and statewide collaborations and research addressing childhood trauma, including parent mental illness and substance abuse, child abuse, domestic violence, and discrimination. Dr. Goldfinger, thanks for joining us tonight.
Thank you for having me, Councilmember Bonin. I really appreciate it. I kind of feel like the new kid on the block here with this group, both as a pediatrician and in my new role as the CEO of Didi Hirsch, now only about 7 months. I know we've been providing services on the West Side for some time, but I'm grateful for the opportunity to join you all tonight. and because my area of focus is childhood trauma and essentially what you might think of as the origins of mental illness and addiction and suicide. And so I'm excited for the opportunity to share that with you tonight. Just briefly, Didi Hirsch has been, as you mentioned, in Los Angeles for some time. We provide services to over 150, 160,000 lives a year through the outpatient mental health services.
He's recording John. He's on the thing right now.
That sounds like one of my board members actually signed in or something.
He's talking right now.
Yeah, there we go. Whoever that was is now muted.
I think somebody sent them my link. Yeah. So we provide services, as you mentioned, for the full gamut of mental health, substance use, and suicide services. Particularly, our real area of distinction is in the mental health crisis services, or what's sometimes referred to as the behavioral health crisis care continuum, where we are the oldest and the largest suicide prevention center in America, as far as we know, one of the only places in America where you can see in giant letters emblazoned on the front, Suicide Prevention Center, which serves as a symbol of hope for many, and many walk in off the streets where we're able to serve them. And thanks to Dr. Sherin and the Department of Mental Health and funds from the state and others, we're actually able to be available 24/7 in English and Spanish, serving as one of only 3 centers on the National Disaster Distress Helpline, as one of only 3 centers available in Spanish for our citizens and those across the country, and on the National Suicide Prevention Lifeline, where people usually know they can reach us at 1-800-273-8255 for those listening. But we're grateful to be here, grateful to be able to talk about the impact of the pandemic on children. As you mentioned, this has been and Ian mentioned, this has been a significantly difficult and traumatic time for our children and our youth and parents, who then translate that in the forms of various traumas we can discuss. And we really need to be mindful of the childhood trauma that is ongoing as children stay longer in their homes.
Great. Thank you, Dr. Goldfinger. And thank you to all 3 of our panelists. We'll get into some questions now. And I'm going to start with a question we got from a few people. I happen to know from my own experience that mental health issues are not something that are a constant. They can manifest over time. In my case, my struggle with chronic depression happened after my younger sister died over a decade ago. Various different things trigger things and make them more significant. One of my constituents from Pacific Palisades is curious, and this is a good framing question for our discussion, about what types of mental health issues have been manifesting most commonly as a result of the isolation and confinement that people are experiencing over the past year. Who would like to take that? Eden, go ahead.
Yes, I'd like to start. Well, depression and anxiety have been rampant. The suicide rate is, you don't even want to know the statistic. People who have never suffered with a mental health disorder are now experiencing difficulty and don't know what it is. So, and people who were already experiencing some sort of mental health disorder are even more, are just struggling even more. The isolation, we're not meant to isolate as human beings, and it's very, very challenging for all of us, especially during this time and trying to be safe. That's why I did put in there some anxiety coping skills in my presentation. It is very, very important to try to just to know some anxiety, some coping skills for anxiety as well as depression, and to do them in a safe way. I think there's still a lot of fear, even though things are opening up, because the rates of the pandemic are still high, and even though there's still a vaccine. So I would say that that really looking at the signs of depression and anxiety are probably the most important. And then what level, and then what do you need to get help? If anybody else wants to jump in.
I mean, I would concur about depression and anxiety and the incidence going up. Problematic across the board. And as you said, for many people who really haven't suffered in a profound way historically. And I mean, I'm always looking for silver linings. And the silver lining there is that, you know, pretty hard to deny the importance of mental health when, you know, our county, our state, our country, and the world is experiencing something so profound. So I see this as as fuel for the advocacy efforts around mental health. And, you know, I think that you point out a couple of really, important things, Eden, about always being able to have someone that's trusted, that you love, that you can reach out to, whether it's a family member or a neighbor or a friend, and whether it's in person or it's virtual. And obviously it's quite difficult in person, and that we develop really good, healthy routines and maintain those fundamental routines that we always rely upon. And that we avoid unhealthy routines like, spending all time trolling the internet for information that's largely conflicting, and relying on drugs and alcohol, which is always something that, can be, damaging and disastrous. And I think we're seeing the addictions rates go really, really high. And I don't expect that that's going to abate for some time, because as I was saying in the beginning, it's not just about the virus, it's about, so much more. And then the last thing I'll say is that one of the keys to a healthy human condition and to well-being is having purpose. You know, when I speak to the schools, I'm always talking to the kids, but unfortunately more so the administrators and the teachers, and saying, hey, these kids have to be engaged as the engineers of the future. Give them the opportunity, the platform to provide input and shape the way that we do things going forward in an additive way, so that the lessons we learn now, are leveraged, when we can do some of the more traditional stuff, but in being engaged and in being heard, and with good ideas actually impacting the way that things are done, kids will have that sense of a purpose, a mission in their daily life that will have a bigger impact on their mental health than, frankly, and I can say this because I'm a psychiatrist, treatment for many, many cases.
Great, thank you. Let me ask a question about seniors. I have a constituent who wrote in a question, a constituent from Delray, whose parents live in a different city. And so she is in touch with them only remotely. And she's curious, what signs does she need to be looking for when she's communicating with them to indicate whether or not they may be suffering from isolation or depression, or any other signs that her parents may need help? Eden? You were nodding the most vigorously.
Okay, I was thinking, yeah, that's a good one. So before I talk about signs, though, I was thinking about the importance of a plan, and everybody should have a plan should they get COVID. And that's one of the drivers of anxiety. And it's funny because when I talk to others, they're like, what are you talking about? So think about have you thought about getting COVID, whether you're a single person, what is your plan? Do you have the apps in place to have food delivered? Do you have someone that you can call if you feel like you need to go to the hospital? What if you're a family? Have you and your partner talked about what you would do if one of you got COVID? What about a child? If one of your children got COVID, what would be the plan? And the plans are different, varying on the child's age. A 16-year-old certainly can quarantine in his room, but what about your 7-year-old? What about your 5-year-old? They know the fear. And as I'm talking to families, these children, I talk to each other and they're like, I'm going to be locked up in my room it's like, no, you're not going to be locked. So talking to your children about the importance, and that settles anxiety too. The importance of, we have a plan and we know what to do. Should mom or dad get sick, or should mom and dad, or dad and dad, our partner and our children, we are going to do the best that we can. I talked to my kids about that. I had a friend who told me she tells her kids, if you touch anything, you're going to die. Well, I don't think that's the best philosophy. That's certainly a philosophy, but I think that instills more anxiety. So I wanted to make sure I said that, because I think we all know what to do to try to prevent, but the importance of a plan is very, very important. So in terms of depression, is your senior parent calling less? When you're chatting, what are they saying? How are they eating? Even though we're not meeting in person, are they still meeting with others through Zoom or doing social distance? What about the exercise? Are they walking? Has their routine changed? Those are things to look for. And I'm sure Dr. Goldfinger or Dr. Sherin can add to my list.
I'm more of a baby doctor, so I'll defer to Dr. Sharon on this.
Dr. Sharon, anything you'd like to add to that?
No, I mean, I think those are really good points. Basically, when, and I would say this is true particularly of younger people and older people, that any kind of change in a routine or a behavior or new complaints or things to take seriously. I mean, and it can show up as a somatic symptom, which is like a physical complaint, again, in either population, as well as, being more isolative, or even sometimes being, overly active. And I would say that particularly with kids. So it's changes in routines and observations that I think are key indicators that there may be something going on that has a psychological etiology.
Yeah, I would just add, I completely agree with what both Eden and Dr. Sharon shared. And I would say that the only other thing that might be of use is to realize that seniors, which is probably also true of other members of our population, but they may be more likely to not feel comfortable using new technologies. So just because you don't see them on the family Zoom, you might assume that something is wrong. They may not be comfortable, and that might just be part of the issue. But at the same time, if you don't see them on the family Zoom, that could also be a behavior change. So I think that since we use technology so much nowadays to interact, we need to be mindful of their unique needs and whether those signs are related to the technology or perhaps depression or anxiety.
Well, with that, Dr. Goldfinger, let's go to your area of expertise. Let's go to the other end of the spectrum and talk about kids. I've gotten dozens of questions, all sort of a variation on the theme, from parents of young kids who have been cooped up in the house for the past year, who've been struggling with frustration, the frustration of remote learning, of not having access to their playmates. The most basic question parents are asking is what advice can you give them right now while schools are still closed and we're unsure when they're going to be reopening?
So I think we heard a lot of the similar advice that helps. The first and foremost is to help our children understand what's going on in a developmentally appropriate way. We wouldn't necessarily tell the first grader everything that's going on the same way we would talk to our 9th grader or 12th grader. And it's important that we think about that, because sometimes when we're stressed, we tend to relay the message the exact same way. Our brain goes into autopilot. And we ourselves as adults have been more stressed, more anxious, more depressed. What's interesting is that the data on anxiety and depression that was discussed earlier, as you get younger and younger, the rates are higher. So interestingly, in America, teens and young adults had the highest rates of any age range of mental illness, any mental illness, and the lowest rates of access to care. Whether that's because the stigma that their parents feel about them and how they feel has precluded them from accessing mental health services, a workforce shortage of professionals, including and especially psychiatrists who treat children. There's a number of factors, but young people were experiencing prior to the pandemic mental illness and symptoms of anxiety, depression, and rates of suicide and suicide attempts higher than almost any population. Well, now they're actually experiencing even worse. So it was there, but it's a lot worse. So we need to be paying attention. I always remind parents, first, you know, when the plane is going down, put your own oxygen mask on. Make sure that you're checking in with yourself. Our children often respond to our verbal and often nonverbal cues. They see I'm stressed. They see I'm running by. You know, my kids, it's my birthday tomorrow, actually. They said, is there any chance you're not going to work tomorrow? That to them was, this is my dad. He's always working, right? He's always dealing with something in a crisis. That's my job. But at the same time, the way that they experience that is a parent who could or perhaps ought to be more present. And so we need to check ourselves. We need to check in with our own mental health as parents, because the most common and most improvable, I would say, trauma for children is actually their own parents' mental health and well-being. Mm-hmm. And we need to focus on our anxiety, focus on our depression, do something about it, speak to our friends, our family, colleagues, whoever is that one for us, certainly get treatment, therapy if we need it, and be honest and open about how we're doing, because they'll experience it. Even if we don't think they do, they do. Children know something's not right with their parents. And then we need to monitor them, and children actually exhibit symptoms somewhat different developmentally. So babies actually have an emotional life. They may change their sleeping habits, their eating habits, especially highly related to how parents are doing emotionally. Toddlers more likely to lose developmental milestones and throw tantrums if they're, or even become aggressive if they've been traumatized. School-age children, that's where you really begin to see the behavior change. A teacher will say, your child is not his or herself. Or nowadays in Zoom might be harder for the teacher to know. So a parent might say, you know, they just constantly sulking, or saying they're bored. That's, I'm so bored, is a classic sign of mental health challenge in a child. Certainly looking anxious, biting nails, things like having a hard time focus. So kids might have been great students and all of a sudden their grades are slipping. And then teens show typically symptoms of being withdrawn or being more aggressive and taking greater risks. So, you know, we might notice them to do something that doesn't really seem like them, again, with the theme, some change in the behavior, but it's kind of like, are you really trying that right now? And if we experience that, we should be thinking, any of these, is our child struggling emotionally, showing signs of trauma? And particularly in girls, people often forget, they may have, teenage girls, changes to their menstrual cycles. That's another kind of classic physical symptom that's related to mental health that often parents overlook.
Thanks, Doctor. Of the questions we got, there were three general categories that drew a lot of response. Two of them I've asked about. One was about seniors. The other was about youth. A third one was about homelessness, which Dr. Sharon referred to in his opening statements. Obviously, homelessness is a huge issue and a tremendous crisis in Los Angeles. Those who are living unhoused, who are experiencing mental illness, are among some of the more visible members of our unhoused community. And Dr. Sharon, a lot of people were asking, what resources does the county provide to help people who are unhoused, who are experiencing mental health issues?
Well, we provide lots and lots of different resources. And as I was saying, we have to recognize that it's not just one population and there's not just one type of mental illness or addiction. This is the biggest problem of our time pre-COVID, and it's continuing to play out, at least from my perspective. And I've spent a good part of my career taking care of the most vulnerable and sickest people who are struggling with homelessness and incarceration. We invest heavily in different types of housing. We invest heavily in outreach and engagement to connect with people that are in the streets, and then getting them into housing and providing them services, and pushing for people to recover. But they're really any of you are more than welcome to take a look at the county sites or the Department of Mental Health website to look at the massive number resources. I mean, my department, which is about a $3 billion department, spends, probably $750 million to $1 billion a year trying to provide, housing and services for homeless every year. And that number is just growing. And it's been growing a lot actually since I've been here over the past 4 years, because I believe that the Department of Mental Health needs to take responsibility for those individuals who are homeless because of the severity of their illness. Because if we're not going to do that, then it's not going to happen. And to be honest, that's, I believe, a cultural shift. If I could, I just would like to make a few comments. I mean, homelessness is not just about not having, a roof or housing. It's about not having community. And we are decades behind in developing the kind of communities that are resourced adequately and that are inclusive, that we need for people to really, truly combat the homeless crisis. I mean, if you just look at housing as one resource, because there are many, the ingredients to well-being are myriad. We're 500,000 units of housing short in Los Angeles County, 500,000 units. And when you look at what it costs to build a housing unit, it's like $500,000. So you tell me how we're going to build out of that. I mean, we want to try to build out of it in a very intentional and sustained way, but that's going to take a long time. It took a long time to get here. So while my department might put in, a couple $100 million into housing every year, it's really tip of the iceberg. And many, many other county departments in the city and the state and the Fed also are funneling money in. But I would say, and I think, Councilman, this is something that you and I probably would agree on, is that we have to recognize that building housing is one of a number of strategies that must be employed to deal with this situation. And I have argued for a long time, and did so vigorously at the VA, and I was talking about it a bit earlier, that we leverage the assets that we have, like vacant land, whether it's a park, or whether it's a parking lot, whether it's facilities that have not been leveraged or are dormant, and set up places that are dignified for us to have communities, even if they're pop-up communities, organized camp-like communities, so that people are not alone, isolated, and literally on the street. We can build, like in the military, when we deploy 1,000 people in the middle of a desert, it takes about a week to put together a really nice community with great sleeping conditions, nice sanitation, great food, jobs for everybody that's there. How can we possibly not do things like that as a part of the solution? And I am, with many other people, trying to drive towards those kinds of solutions to improve the life of so many people who are just simply, right now, lost from communities. They're refugees from, our communities. And I actually have an agenda here aside from being a humanitarian, and that is, the more that people sit out in the streets, the more customers we have. I don't need any more customers. You say that we serve 250,000 people. I actually don't know what that number is, and I'm trying to explore it, because there's so many different levels of care. But we need twice the amount of resources that we have right now to take care of those folks. And my department is really charged by the state to target those who are the most ill, not the entire population. So the funding streams for these things are so complicated and frustrating, quite frankly. Go ahead.
I was glad to hear you talk about what I refer to as safe camping. And as you probably know, the VA opened up a small area of their campus in Brentwood for safe camping. So there's people camping on the inside in tents and camping on the outside in tents. One of the benefits of having people camping inside is it's easier to provide services like mental health services. One of my constituents in Venice asks that they say they understand the services that the county provides to people who have sort of gotten into the system, whether it's safe camping or long-term housing, but they're curious what services are provided and how they get provided to the the tens of thousands of people who are living in encampments now?
Well, that's it. I mean, that's a big problem. And people that are living in the streets and the encampments, many of them are there and they're for a variety of reasons, and they're there for long periods of time. And, what I'm suggesting here about building out, what you'll call safe camping, and I'm glad to see that the VA finally opened up the Grand Lawn. They've been pushed to do that for some time. Yep. That's an important thing. But the other thing that I think is challenging, and one of the things that's really quite scary, frankly, to our residents and to kids and to families, is when you have people who are really unstable that are in the street. And you mentioned, us looking at public health and public safety reform. And right now, I've been asked by the county to lead an effort to develop an alternative crisis response. We have. I'm just going to say I have about 100 teams across this county that respond in real time to urgent and emergent issues in wherever. It could be in the street, it could be at Walgreens. But it's nowhere near the capacity that we require. And we rely upon law enforcement way too much to try to manage health and human service issues that evolve in real time. So we probably have to triple, quadruple the amount of crisis response resources that we have so that we can deploy teams. And those teams have to be coordinated very, very effectively, efficiently by organizations broadly, and I would say centralized with Didi Hirsch, who is in the relatively near future is going to be mandated by the FCC to be our regional call center. And then when people are engaged by crisis teams, we have to have somewhere for them to go. They, maybe they have a boarding care and they need to go back to their boarding care, or maybe they have housing, but we need urgent cares. We need residential treatment beds. We need what we call peer respite beds so that we can get people who are having a crisis off of the street. But it gets to the complexity of the challenge. There are many, many layers, and it's only if we can become more coordinated. And I think this is one of your platforms, which is we have so many different decision makers, elected officials who are not, and we are not well coordinated as a system and integrated as a system where people have responsibilities, they have the resources they require, and they're held accountable to taking care of their puzzle piece.
Let me ask one more question about homelessness, and then I want to get back to sort of some broader, more universal issues. So if you'll just pardon me, one more question for Dr. Sharon, Eden, and Jonathan. A question I got from Venice is about a lot of the work you do and about one of the solutions to homelessness. You talked about the need to provide housing. One of the things that has become a commonly accepted and widely embraced solution to homelessness is the concept of housing first, housing somebody before they may be on their meds or before they have gotten sober. I'm hearing more and more pushback on that. And somebody, from Venice asked me in the questions, why would we be putting someone into housing who isn't prepared for housing? Would you respond to that, please?
Well, this is a tough question. And I mean, I will say when I was at the VA, I pushed hard for what we call low barrier, low demand housing. What that means is that you just come in off the street, and low demand meaning you don't have to take all of these programs, all day long, because if it's high barrier, people don't come in, and if it's high demand, people won't stay. So it's a balancing act. And one of the things that I would say is that due to the complexity, we have to come up with multiple solutions, multiple recipes that can address the different needs of different people. I understand very well that, that harm reduction type models are concerning, and that in many ways the NIMBY, the pushback in communities is based on the fact that people don't feel safe. And what I've always said is that for those facilities that are a bit progressive and that are more flexible. You can't use on the property, you can't fight on the property, and you can't destroy the property. Those are the 3 strikes, because when you do that, you jeopardize that environment for everybody else that's there. So I think we have to develop a balanced approach, recognize that there are many, many solutions, and we have to figure out a way to engage our communities in a much, much more transparent, honest way. I mean, these are collective problems. They're going to require collective solutions. And if we think we can just kind of fence people or not somehow participate, in the health and the well-being of all of our brothers and sisters, as challenging as that might seem, we'll never get a solution. We'll never get it. We have to invite the neighborhoods to be a big part of the solution in a way that makes sense to them.
If I may, council member, on this subject, to back up what Dr. Sharon is saying, this NIMBYism, not in my backyard, right? It reflects an attitude that these people are lesser than, they're not members of our community, when in fact many of them are. Some of them related to mental illness are on the street, others lost their jobs, whether from the pandemic or other, financial crises. And so I think part of it, in addition to what Dr. Sharon is saying, is we really have to find ways to humanize the story of those living in our streets who have, suffered this trauma, and make it relevant to everyone in a way, as Dr. Sharon is saying, it's not about the threat to you. It really is scary. I mean, I've walked down, the street have young children and seen somebody actively with psychosis, with my little kids, and thinking of, what do I do? Do I cross the street? Don't I cross the street? I don't want to disrespect them. I don't want to teach my children something about those who suffer from mental illness or schizophrenia that's wrong or stigmatizing. So I have struggled with that in my own neighborhood. So I completely get it. But people need to realize that these are human beings. They need to be thought of, and they need to be cared for as members of our community. And if we don't find a way to feel that way about them and to respond, then it's just going to get worse. The fear and stigma and trying to marginalize, that's not my problem, is only going to make it worse. People need to engage and come up with constructive and as Dr. Sharon said, flexible solutions that actually lead to sustainable change.
Thanks. Moving on to a different subject, and we'll probably wind our way back, I'm sure, through some of the other questions to homelessness, but a constituent of mine in Mar Vista asks the following question. As the COVID-19 vaccine is being distributed to select groups, some people are proudly bragging on social media they've received it, while others are waiting for possibly months before they get their first dose. How should the community be sensitive to the anxiety and possible confusion around vaccine distribution and reactions to distribution? How can they be sensitive in a way so that it doesn't exacerbate the anxiety of some of those around them?
So as a pediatrician, I'll jump in first here, and I'm sure you have plenty of advice on this. We typically don't experience this in pediatrics where you have some parents saying, oh, my kid has it and your kid doesn't. This is a strange thing. In fact, I would wonder, what is it about the mental health of people who are bragging about it? Why do they need so much attention? Why are they rubbing it in other people's faces, as the question implies? And even as we know, were they in line? Were they in the order? Are they following what the public health officials have said in terms of who needs to go based on ethical principles? These are all important issues that we need to grapple with as a society. And I think if it's said in a way to encourage others to get vaccinated, that's one thing, and we should applaud it. We know from studies of human behavior that those who do things a little bit differently are more engaged in a healthy behavior and promote that behavior and show how great it was as an experience, or not harmful as an experience in the case of the vaccine, that can promote others to go and get vaccinated. So we don't want to shut down members of our community saying, I got vaccinated, but I do think we have to find ways, and social media in general is this kind of toxic environment, unfortunately, where people with often a need for attention, right, or some mental health challenges, are on there trying to promote themselves constantly. So unfortunately, those who are on there watching get that experience, you know, of I'm missing out or something's not right. So the first thing is what Eden said, I would get off of social media, get off of it. It's not healthy in any way. I don't know that it's almost ever been shown to be healthy, and it's often been shown to be unhealthy. And if you don't believe me, watch the new Netflix, I think it's called The Social Dilemma. Very scary stuff from executives at Google and Facebook talking about how we've all been manipulated on social media for a price on our head for advertisers. Negative and destructive behaviors are what these social media platforms feed on. So we need to kind of just shut down. That's the only way to stop that. And then we also have to recognize that anxiety, as Eden said, is about, do you have a plan? Can we do something? Can we do something about it? So the answer is we can do something about it. There are actually useful online resources and public health websites that have gotten better and better at, making appointments, as well as telling us when it'll be our turn. I believe the state of California has one now, but I'll be quiet, Eden. You probably have some other advice.
Well, you hit it right on the nail. I mean, I really don't think I could have said it any more eloquently or beautifully than you did. That's absolutely, all of it is correct. I think that what the constituent is talking about is that person that's not a healthcare worker, that's not a senior, flaunting that they got the vaccine. And we've all seen it. But what you can control is your own behavior, right? We can't control others. We can't control what they do, what they post on social media. And getting angry or getting anxious about it is only going to impact you, not the person who posted it. So as Dr. Goldfinger said, how are you informed? Are you watching to make sure that when your tear is going to come up so that you can get the vaccine? Is watching social media creating more anxiety, then you need to figure out a plan to, not be on those platforms as much. So Dr. Goldfinger, like I said, I really think you hit it on the head. Thank you.
Great. Yeah, for those who can only see one face at a time here, I'm not sure how it's coming across on Zoom. I think it's fair to say that 3 out of 3 mental health professionals say get the hell off of Facebook.
All dentists, they all.
Next question is about domestic violence. And someone in West LA is asking, how can available mental health resources help prevent or deal with domestic violence during this crisis?
Well, I mean, there's a lot of concern, and there's data to suggest that, rates of domestic violence and including child abuse are up. And that, I don't think that's surprising. And what I would say is that, there are a number of different resources available. Obviously, people call 911 if there's an emergency and there's concern about, of an acute violent scenario. There's the Department of Child and Family Wellbeing, of Family Services that is always, 24/7 available to investigate situations. The Department of Mental Health, we have a crisis line. It's 800-854-7771. And I'll repeat that, 800-854-7771. You might see it behind me. That is, we're always available. We're available to take a call to provide emotional support. We're available to provide information and referral. And we're also available to dispatch and deploy crisis teams. I wish I could say that when we were called, we could get there rapidly, but we are not adequately resourced to do that. And that we're deeply committed, and I say that for all 5 of my bosses to changing that scenario so that we can get out and help really respond much more appropriately. The issues with domestic violence and child abuse, I think, are going to rear their ugly head more and more over time, because we're not aware of a lot of what's happening. And a lot of the issues that we face as service providers that really require face-to-face intervention and evaluation are not as active as they usually are, and probably need to be because of basic public health orders. I mean, like Eden said, I mean, we've had the same experience. We're seeing more people. We're having less no-shows. We're having more encounters because of telehealth. But, you know, are there scenarios where, and we're also, our clinics are still active in person. A lot of the work that we do when it, you know, relates to injections of medications or people who are unable or unwilling to kind of engage through telehealth, we're still active there. But I do believe that our reliance on telehealth is going to, and it's not just talking about the Department of Mental Health, I'm talking across the board, because of the pandemic, is probably going to show up in some ways that that are unfortunate, and we have to figure out how to re-engage. And for me, this is really an issue of access. I mean, we need to figure out more effective ways for people who are at risk or, you know, in imminent danger of getting help right away. And while, yes, we do rely upon law enforcement to do that, I think that there are many other ways that we need to bring to the fore.
Thanks. I got a couple different questions from people about grief from a different perspective. One from Brentwood, one from Playa del Rey. Trauma often triggers someone's encounter with a mental health experience. Grief is a huge form of trauma. A lot of people have lost loved ones. And a couple people have asked in a variety of different ways, what mental health resources are available in Los Angeles or on the West Side to help people who are experiencing grief due to the loss of a parent or loved one during this crisis?
I'm sure we can all answer. I would just throw out, kind of dovetailing on my last comments. I mean, we have a tremendous amount of resources on our website that I think are very useful for people to read through, including processing grief. We have a helpline that's available 24/7. We're also offering Headspace, which is a mental health app, to all of Los Angeles County free of charge. We have, in the very near future, a virtual CBT program that will be available to everybody in Los Angeles County, which is actually surprisingly been shown to be effective as in person. Sorry to all the in-person therapists, but avatars can be very effective, and for certain people, for a lot of reasons, including the flexibility and the user-friendliness of being able to call up your kind of avatar therapist at will. And in addition to that, I had mentioned before that we have the ability to in real time, take a call, provide emotional support, and make referrals to incredible places, you know, like Eden's clinic, or like Didi Hirsch, if not to our clinics. I mean, unfortunately, a lot of that depends on, do you have insurance? Do you not have insurance? What kind of insurance do you have? So it becomes a real game. It becomes a bit of a maze. But we, as the Department of Mental Health, really are trying very hard to help provide that navigation to people, so that for things like grief, that you can get real-time support, and that you can set up longer, more involved types of therapeutic treatment opportunities through a variety of providers throughout our network.
Anyone want to add anything to Dr. Shering's answer?
All I would add is that grief may come in the form of, oh, sorry, Eden, did you want to jump in there?
I'll go after you. I'll go after you. Go ahead.
I would just add that the grief may come, you know, in or due to non-COVID, you know, losses or deaths. I think that we have to recognize and encourage everyone to recognize that it might be the loss of time spent with certain loved ones or friends. It might be the loss of, for children, it's certainly the loss of the time spent with their friends and their teachers. And all of that, you know, is important to be thinking about. It's important to be paying attention to our loved ones, our children, our friends to the best of our ability, and reaching out and saying, you know, I think one of the things people forget is that we are often the best mental health resource. In every study of human behavior and trauma, safe, stable, nurturing relationships with people who are doing okay and are just there to listen, to lend a hand, to say, I'm listening. And they actually listen in a non-judgmental way. Every study shows that that actually helps. It physiologically changes how our body, our brain, and our organs react to stress. Another calm, stable human being to talk to. So, you know, reach out to people, be that one for people who are going through a tough time from whatever is the cause of their grief. And that can be a tremendous help, in addition to, of course, mental health resources. And the last thing I'll say, there's a number of buffers of the toxicity of stress, in addition to other humans: exercise, sleep, healthy nutrition. You know, these are things that we kind of take for granted. Certainly mindfulness and meditation, like apps like Headspace. I use Headspace thanks to Dr. Sharon and others, free membership, so I'm happy to pay for it. And I love it. It's really changed my life during the pandemic, absolutely changed my life and my ability to focus and feel whole with everything that's gone on. Eden?
You're on mute, Eden.
I still do that after months of Zooming. So thank you. Yes, I couldn't agree with the both of Dr. Goldfinger and Dr. Sherin. And we should not underestimate grief. Just being isolated alone is a huge loss. As Dr. Goldfinger, not seeing your friends for children is a huge loss. And grief can be compounded. So it could be that grandma passed away, but your child or an adult is also grieving something else. So it is even more intense. We often refer to the Department of Mental Health, their website. It is very, very inclusive. It has a lot of resources. So I encourage people to go to their website. And all three organizations can support grief. So just, you know, we're all here to support and can provide the grief counseling or do groups as well if needed. Thank you.
Thanks, Alia. The next question is about schizophrenia. I've gotten a couple people, including one from Mar Vista, who asks, what resources are available for families that are struggling now with a family member who has schizophrenia, and how should they handle it?
Well, I would say that the resources that we've been talking about, and certainly from the Department of Mental Health, are available for people who may be suffering from pandemic-induced depression and anxiety, but also for individuals suffering from schizophrenia or other psychotic disorders, and that there are programs, and we're trying to grow them for people who are early on in their illness. So, you know, young, late teens, when there's an onset of a psychotic disorder, it's absolutely critical to reach out to us. And whether we provide those services or whether we refer you to someone or to doctors to address your illness, it's really, really important to get in front of it. Unfortunately, because access to really high quality treatment in our field is frankly unacceptable because of issues with parity, which we're trying to address. Too many people become chronically ill, and they suffer from repeat psychotic episodes, which really in many ways consolidates those types, the disability and the inability to really process information in a way that's required to navigate our complex world. But my main point here is call the Department of Mental Health if you have yourself or loved ones or someone in the neighborhood or someone that you know of or even at work where there's issues related to aberrant behavior, strange ideas, concerns, excessive paranoia, to get help. And we will figure out a way to do that. And if it's in the crisis time frame, we'll try to respond as quickly as we possibly can. And if it's something where we can, where we can set up appointments, we'll do that. And my hope is that over time, we will build more and more capacity so that access isn't so challenging to our public, who we're here to serve.
Thanks. A question that I get a lot, that I'm sure you get a lot, that has been asked a lot by people who RSVP'd or have sent in questions, is about people who are suffering from a very obvious mental health episode, who refuse to or decline treatment. And the way the question is asked in one right in front of me is, why are we, meaning I guess the government, unable to involuntarily put someone in the hospital for their own good when they are doing themselves harm or refusing to avail themselves of available resources?
Yeah, I mean, I can't help but jump on this one. I mean, because it's core to my whole role. And, you know, I don't know if I've written a couple of op-eds in the past several months about this issue. We have state laws that kind of provide the guidelines around involuntary treatment. Those laws are at least 50 years old. This is a lightning rod issue for very good reasons, because what we're talking about here is honoring and respecting autonomy of an individual versus being paternalistic and interventional. And what I say to both is that we must be humanists first. And that what we have to recognize is that when people are suffering and they're not living safely in the community, and they're unwilling to accept care, we have to have, you know, the ability to engage. The most important thing about engagement on the front side is to come to people that have needs with guaranteed resources. You don't go to someone and say, oh, can I help you? I can get you housing, and not have the housing or not have the appointment or the team.
That happens a lot.
I know it does. I know it does. And actually, we have a pilot right now called the Home Pilot for our homeless outreach and mobile engagement teams who have guaranteed resources. And they're going out to the most ill individuals in the street. And the goal there is to exhaust with relentless outreach and engagement efforts the ability to engage voluntarily. And then what I'm saying and what I'm working on with many people at the state is we need tools of engagement. We need a continuum where we step up from less interventional to ultimately, right, the most interventional, which is conservatorship. And a conservatorship actually, for me, is a guaranteed resource. It's someone to help you be a steward in your life. It's guaranteed housing. It's guaranteed access to a treatment team and to treatment beds, locked and unlocked, until an individual can kind of begin to recover. The idea of involuntary treatment is to mitigate the need for it, because people become more capable of assuming and acting on as an autonomous agent in their own life. There is the ability for us to put people on holds for short-term, 5150 holds, that are used a lot. The problem there is that you have individuals who are put into the hospital, which quite frankly can be very traumatizing when it's not absolutely indicated. They gum up a system that's already overwhelmed. It costs a tremendous amount of money. And the hospitals lose money as business entities by having people that are stuck on their psychiatric wards. And over time, with repeat hospitalizations, short hospitalizations, we don't gain the ground that we want at everyone's expense. So what we're trying to do is we're trying to figure out a more sustainable solution and the ability to engage. I'll give you an example, the advanced directive. The advanced directive is one of the tools that I'm recommending before going to a full conservatorship, where you have individuals, and when they're relatively stable, they can say, this is the doctor that I want to see. These are the medications that I will take. This is the hospital that I would prefer. This is where I want to live. So that when a court, based on clinical input, determines that an individual is not stable and that the advanced directive kicks in, then for that period of time, you can compel treatment just for a short period of time until that individual could recover. So this is a challenge of engagement, as you point out, Mike, and we have to recognize that it's, again, like many other things, it's very complicated. We have to have individualized approaches to engage different people, and that we need a continuum of engagement tools.
Great.
If I may,
yeah.
Council Member, the only other thing, completely agree with what Dr. Sharon is saying. What I would add is we also have to think about the trauma of the family members going through this, right? For lack of all the tools that Dr. Sharon has mentioned, the experience of families, if you ask any families, either your constituents, or I'm sure we all have spoken to people who have those with a number of forms of serious mental illness, but particularly the most severe cases, will say that they just keep having this experience. They just keep having this experience like nothing works. No one can help. I hear that a lot. You know, they feel helpless. They are traumatized. So I think in addition to what we do to focus on the individual, and completely agree, it has to be about their autonomy and their ability in advance when they can to give us that. We also have to support the family, and we have to support the community in being there for this person. And if you're a family member, as I hear, and you've tried over and over again to help your sibling, I was speaking to someone the other day, to help your sibling get care while you took care of her daughter, and she's refusing the care, that can be a very fractured relationship and a very difficult time. But we kind of tend to focus on the sibling who needs help and not the rest of the family. And so that unit needs to be there, and we need to be supporting all of them so that they can be there and be that respite, be that support for their family members, because these are ongoing, sometimes often lifelong challenges.
A constituent from Playa Vista asks a sort of a 10,000-foot question. How the hell did we get in this mess? Why is the county jail our mental health service of first resort? And why don't we have community mental health clinics all around Los Angeles?
Those are, I mean, you got to restrain me with some of these questions. I mean, in the early 60s, very well-intentioned president, John F. Kennedy, kind of mandated that we deinstitutionalize because it was inhumane to be warehousing people. Some parts of the world, very few, built out and developed the right culture in their communities to be inclusive communities where everybody belonged and everybody had a purpose. We did not do that. We did not do the cultural work. We did not build up community mental health centers the way that we had been mandated at all. So we moved from state hospital type institutions to a different set of institutions. I call the streets the open asylum, and I call the jail the closed asylum. And we've got people that are languishing there, not getting, I mean, in conditions that are far worse, I mean, at least from my perspective, than being in a treatment environment in an asylum. And what we have to do is we have to build up and invest in communities, not only just in terms of the resources, but something that's been coming up here, it's come up a couple of times, and that is recognizing that everybody has to belong in our communities. We have to be a collective. I mean, the memo from COVID and the anti-racism work and how we're responding to like vaccine, like, can we like look after each other? We're interdependent. We, or other, what we say in the Department of Mental Health is that none of us are well until all of us are well. And we have not taken that approach. So we blew it in terms of how we responded to deinstitutionalization. And until we invest in community and build up community appropriately, and it's not just treatment, it's also dealing with the social determinants. Until we have a crisis system that guards people who fall out of the community and catches them and stabilizes them and brings them back into the community. And until we have an adequate and robust reach into the institutions, to the asylum, and bring people back into the community at an adequate capacity, we're going to have the same situation. And frankly, we're losing. We're going backwards right now. And I think a lot of that has to do with our socioeconomic situation, some of which is now related to COVID, but I think a lot of it predates it, and it gets to the core of the American dream, and how can it be a dream for everybody?
So Eden, when in Dr. Sharon's question, he talked about going back to the 60s, the move towards deinstitutionalization. I think it was back around then that a hardy band of forward thinkers in Westchester, Bud and Mary Ellen Kastman and others, decided to push forward and create the Airport Marina Counseling Service.
Nice.
They got some pushback at the time, as I recall from the stories I've been told. Representing an organization that is one of the responses that we need a hell of a lot more of, what sort of guidance can you give about how to build out more capacity like Airport Marina Counseling?
Well, you're right about the pushback. So Mary Ellen will talk about the fact that they thought she was a communist and that she would get followed. And she would try to talk to these people and help them understand that she was just wanting to start a mental health clinic. But they didn't believe her. But nonetheless, she pushed through, and here we are over 60 years later. I think that there is still a lot of stigma around mental health, that it is still the not in my backyard, which is very unfortunate. It is exactly what Dr. Sherin talked about community, about us all coming together, about the fact that we all have a purpose, that we really need to look deeper into what that is and not this superficial career, what am I doing? What do the Joneses have? It's really looking at what can this person contribute to our community? And all of us have purpose. We can all contribute something. We just have to work together to figure it out. So I do think that, there are, look at these 3 organizations here already doing so much. Access is an issue, but all 3 of us are working to help figure that out. It is more challenging, as both Dr. Sherin and Dr. Goldfinger alluded to, with regards to more of the serious mental health issues, because the focus is usually on the IP, the identified patient, and they need to consent. And then there's usually issues around that. And then there's the rest of the family that people don't tend to look at, who are also suffering and may also be struggling and need support too. So, the whole, going back to just the whole family, treating the whole family community is just so important.
Can I just add one group that I think we haven't named outright, which is ourselves as healthcare professionals. At the highest, maybe it's above 10,000 feet, Rene Descartes 400 years ago came up with this idea that the mind and body are completely separated by a firewall. This makes 0 sense. And the science has actually proven over and over and over again that mental health is health. The mind and body are inseparable. Hope can cure cancer. Trauma leads to heart disease, right? All these things, those with mental illness die, severe mental illness, tens of years earlier than those without. Of physical illness, they die, right? So all of the data shows us that mental health is health. But who's been complicit? Healthcare. Healthcare payers. Dr. Sharon alluded to this issue of parity. Why we pay for mental health services less than we pay for physical health services. This is the only area of healthcare where we don't wait for somebody to have stage 4 cancer before we treat them, right? You wouldn't accept that. But somehow that's okay for mental health in America. And that has to change. We must have parity in terms of how we pay for mental health services, and equity, meaning that everyone deserves access to mental health professionals regardless of their diagnosis, just like they have a primary care professional. Everybody deserves insurance that covers mental health care that they need, not restricted by the commercial or the Medicaid payer up to a certain number of visits, which makes it very complicated. And we are still in healthcare complicit in that. And I say that coming from the physical health side, in much of my career advocating for mental health, and now being, at the helm of one of the largest providers of mental health, substance use, and suicide prevention services. We've allowed ourselves to keep mental health stigmatized, what we call structural systemic stigma. It's a form of discrimination baked in, where you can get physical health, you can get everything for physical health, even the COVID response. You look at the public health COVID response, It's like all physical health, vaccine, virus, all this stuff. And look at the response in terms of funding that's come out of Congress, our state, and everywhere else looking at mental health. It's a pittance because we have stigmatized and baked into the system that mental health is other than, but it is not. Mental health is health, and everyone needs to understand that, and we need to advocate for it like we advocate for all other access to health services.
Damn, that was well said. I agree with everything you just said. And it partially answered the next to the last question we have here, which was asked in a variety of ways. I'll read the question as posed by a constituent in Pacific Palisades. What can the county, state, and federal governments do specifically to help fund programs that would positively affect the mental health in our community, especially in poorer, low income, and communities of color?
Oh man, John, maybe I'll start here. I know you've got Dr. Sharon is a staunch advocate for what our state, our federal government and can do. And I've worked on various areas of thinking of how we might pay for things differently. The first is an ounce of prevention, right? It's worth a pound of cure. That is true for mental health as it is true for physical health because they are the same thing. So when we talk about childhood trauma, I first want to actually give our state props. The governor actually had invested pre-COVID in something we call ACEs Aware, where we are training and teaching. I advised California's new Surgeon General, Dr. Burke Harris, on this. We're teaching primary care professionals, pediatricians through family practice, geriatricians, obstetricians, to identify the experiences of childhood trauma, what we call adverse childhood experiences, which are the origins of mental illness, and then what to do about it. We are actually going to be we are reimbursing them, paying them through Medicaid. So we have invested to some degree significantly in California and leading the nation, focusing on childhood trauma in the prevention of mental illness and substance use. But there's so much more to do on the early intervention side, which means as soon as a child starts to show symptoms of trauma, as soon as a teenager starts to show symptoms of anything from anxiety, depression, to psychosis, all of those things, as Dr. Sharon said, we must get them the care that they need immediately when they need it before it spirals and gets worse, because it does if we don't treat it early and often. And so we really need to invest, I would say, significantly in that early intervention period for what we do for our youth. And I keep coming back to, of all the people of all ages and demographics in America, those who are suffering the worst pre-COVID and therefore are now suffering the worst from the trauma of 2020 and beyond are the young, are Black, Brown, and LGBTQ populations, as well as the homeless population. These are known vulnerable populations that we just do not invest sufficiently in their needs, which really is, shame on the rest of us. And as Dr. Sharon pointed out, it's going to come back to bite us if we don't focus on their needs. And another way that healthcare has been complicit in this is the systemic bias against, those minorities, especially particularly African Americans, in healthcare. So it's true there, it's true in mental health, and we need to get beyond this. We must actively pursue justice in our healthcare systems, and that often starts with policy.
Thanks. Dr. Sharon or Eden, anything you want to add?
I mean, I agree with John on all those points. I mean, we have to realize that institutional inequity, structural racism, call it what you want, whether it's in healthcare, whether it's in education, poverty, these fundamental phenomena are traumatic, and they traumatize populations in a targeted way, intentional or not. And the brain is quite a sensitive organ. It's bad for every organ system to experience trauma and stress, but it's horrible for the brain. It's horrible for the developing brain. And while there are nature and nurture sides to the development of mental illness and addictions, the role of trauma is massive. And in order for us to really go after that, we have to reverse that bias and overinvest in areas of great need. And we're trying to do that in the Department of Mental Health. We have a number of initiatives. The other thing I'll just say is that while the funding is inadequate, the funding is also inflexible. And I say it all the time, and it probably got me into trouble a few times, particularly at the VA. God bless the VA, who I work with still quite closely. That we take care of compliance and auditors and not the people that we're here to take care of. We exhaust resources dealing with medical charts, making sure that, all of the administrative boxes are checked. And it takes time, but it also kind of it's soul-sucking exercise. It exhausts the people who are in the front lines. I mean, there are many community organizations that don't want to work with the Department of Mental Health. They don't want to contract with us. Why? Because it's impossible. Because we're connected to the state and to the federal government, and we draw all this money down. And it's all top down for the most part. And what I have advocated for my whole career, starting in VA, is that it has to be bottom up. We are the engineers, the people on the front lines, and most importantly, our consumers are the engineers. And what's needed there, and that what I call sacred interface, is what must drive the system. And we need to be held accountable to getting outcomes that we want for those people, not complying with process metrics and ultimately taking care of Congress.
And that's the same thing, right? What you're talking about is the discrimination baked into the system, because as a pediatrician, I was not paperworked to death. But somehow in our behavioral health system, whoever set it up, that's acceptable. It shouldn't be. It's a form of discrimination baked in to how we get paid, and what Dr. Sharon's staff work through and what my staff work through as a contracted, community organization funded by Dr. Sharon and the Department of Mental Health. We all are subjugated to a discriminatory financing system, and it shouldn't be that way.
Eden, anything you'd like to add?
Just what comes to mind is the importance, as both doctors have talked about, with regards to as soon as there's trauma to get help. But I even think about preventative. How about that? Like, how about we teach coping skills in school, anxiety management strategies. And I see some of this. I know there's counselors, that's all great. But if the quicker, the faster, the younger we teach our children, then the more socially functioning, more better citizens, that they will be. So I just, it's all about young, it's all about teaching them, that anger management, all of it, not just when they get in counseling, but I think it should be in the schools. I'm sure that some of your constituents have heard me talk about a wellness checkup for mental health. We all go to the dentist. We go to the dentist every 6 months, but we know about our physical, we go to a checkup once a year. We get our blood work done once a year. Well, why can't it be the same for mental health? That we go once a year to get a checkup, and then we determine then a plan for our mental health if needed. It's just as important, right?
Eden, you would love this. The other day, I was getting frustrated with something, and my 3-year-old said, "Dad, he started doing a meditation right in front of me." I said, "Where did you learn that?" "In school," right? But I am privileged. My kids go to private schools, so they have the resources to do this with the kids, even in COVID. But mindfulness and meditation have been shown to be preventive, to buffer that toxicity of the stress, as Dr. Sharon said, on the brain and other organs. And we can teach a 3-year-old how to do it. So why don't we just do that? Why isn't standard curriculum mindfulness and meditation in every classroom in America? We would solve a lot of problems of stress and prevent a lot of costly illness down the line.
100%. I couldn't agree more.
Thanks, everyone. We're just about out of time. So last question for everyone. They describe heart disease as a silent killer. Mental health issues are also silent killers. A lot of people don't know that they are beginning to experience a mental health issue. It sneaks up on them. They don't identify what they're experiencing as anxiety or as depression. As we wind up tonight, what advice would you give people to be mindful of what they're experiencing and what they need to be looking out for in their own behavior or temperament to make sure they're taking care of themselves?
I can jump in real quick. The first thing is that for many of us, mental health may be more scary than physical health because of stigma, because we don't understand it, because we think, oh, this is like brain damage or something, you know? And so I would want people to know, first of all, it doesn't always manifest as behavior symptoms or emotional symptoms. It can manifest as chronic headaches, difficulty sleeping, you know, belly aches, in kids as well, as Eden said when we started out. So we have to be actually thinking about our physical symptoms, because mental health and physical health are inseparable. They are one and the same. The brain just has different chemical things going on when it comes to mental health. So we have to recognize the physical symptoms of mental health. And if that's the inroads for us, if it's because of a physical symptom, we want to not experience headaches, we want to, you know, not have belly aches, we want to have better relationships. Maybe that's easier for people, thinking about its other effects on our health and well-being. And certainly there are actual, you know, signs and symptoms that people need to be aware of and need to get the help that they need.
Go ahead, Dr. Sharon.
I was kicking it over to Eden.
Yeah, I thought so. I'm good. So the importance of the mind and body connection, and being connected with yourself, understanding what's going on with your body. So I think that's important to do, like a body scan more than once a day. Like, what's happening? What's hurting? We move so quickly that the majority of the time we don't even know what's going on with our body. And if something is wrong, we don't connect it with something that's going on in our lives. So the importance of making the time to just take a breath. And how am I doing today? Oh, my neck's really bothering me. Well, I wonder why. Oh, because I'm stressed out about this, that, or the other. What can I do about it? Or my stomach has been upset for days. Okay, you know, then really kind of taking a look at that. I think that we've also lost that, you know, that just like we've been talking about, that mind-body connection. It's all connected, and we don't lose sight of it, or we don't want to see it, or it's just not emphasized. But if we take time every day, we can see what the issue is, and then hopefully try to figure out a plan to resolve it.
Yeah, I mean, one thing I would just say is that one of the kind of classic challenges with mental health and mental illness, even in its not in its most severe form, is a lack of what we call insight. So not being aware of what's going on, not being able to kind of monitor it. There's a lot of material about self-care, which I think is one of the you know, parts of the field that can help train people to recognize things that aren't going well. I mean, if I look for an indicator, I mean, I used to study sleep, but sleep is what is a vital sign for me. You know, it's a mental health vital sign. So if you're not sleeping, or your basic appetites are disrupted, that's an indicator. And as you've heard again and again, these physical symptoms are new pain, back pain, headaches. Those are things that might that might signal an issue. And then the other thing, getting back to my point about a lack of insight, reach out to other people and just say, you know, I'm not sure if something's going on, but am I acting a little bit different? Do I feel different? Is my personality, am I more irritable? You know, are there things that you're seeing in me that suggest that maybe there's something else going on? And then, you know, if there's some suspicion about maybe, you know, needing help, reach out, help break the stigma. I mean, you know, for the love of God, just like, we have to be a part of breaking the issue of stigma. If you hurt your arm, or if you have like a sore throat that doesn't go away, you go to the doctor. You know, you reach out to get help. You call a nurse, you know, at Kaiser. So do the same thing. Be a part of the parity that we need to kind of, you know, infuse in this, in our society, in our culture.
Great. I want to thank the three of you for joining me tonight. Dr. Jonathan Sharon from Los Angeles County Department of Mental Health, Dr. Jonathan Goldfinger from Didi Hirsch Mental Health Services, and Eden Garcia-Balis from the Airport Marina Counseling Service. Thanks all three of you for being here tonight and sharing your wisdom. Let me also thank all those of you who joined us tonight and listened in. I hope that you found something useful tonight, something helpful to you, and know that there are resources available to you. The most important thing, I hope you can... I knew we were going to get a guest appearance
all right.
tonight. Just sit tight. That was as if on cue. I was going to say, please know that if you are struggling, if you are hurting, you are not alone. There are resources available to you. You can contact Airport Marina Counseling Service or Didi Hirsch, and we will make those services, those resources available to you. You can call my office at 213. Stop shaking the desk, buddy. 444-3508, or check out my website at 11thdistrict.com. You can also call the LA County helpline at 1-800-854-7771. Also available is the National Suicide Hotline at 800-273-8255. And again, we will have all of that information as well as the direct info, phone numbers, and websites for Didi Hirsch and Airport Marina Counseling Service available at my office and on our website and on our social media. I thank all of you for joining tonight, and special thanks to Ben Lezebnik from my staff for helping put this together. Everyone, please have a good night, be well, and take good care.
God bless. Thanks, Mike.
Thank you, Mike.